So I have a note from Cameron here who's experiencing what he describes as heartburn. He's in his 50s. He's carrying a little bit of weight and he doesn't mind a drink. So I have to ask Cameron a few questions before we proceed. I think one of the important things about this is that anyone in their 50s who's getting sort of a heartburn type feeling, we have to distinguish whether it's acid coming from the stomach rising up into the esophagus, which is what we call heartburn, or could it be something else like heart disease? Because heart disease can also present with similar chest pain. So it's really important that we have a good hard think about that. If he's getting discomfort after meals or when he bends over or after he has a drink, then it probably is heartburn. If it's associated with an acid taste in the mouth, it probably is heartburn. But if it's a discomfort that's burning when he's doing a little bit of exercise, we might start thinking that he needs to see a cardiologist before he sees a gastroenterologist. Let's assume that his discomfort is related to having a few drinks and when he bends over, and it's associated with an acid taste in the mouth. Okay, now we think he's got heartburn. It happens because the bottom end, the lower end of the esophagus, which is normally protected by a muscular sphincter, it happens because that muscular sphincter relaxes a little bit. When it relaxes, acidity can rise up against the normal flow, against the normal peristaltic flow, and wash up into the esophagus, and that causes quite an intense burn. So some patients have a relaxed lower esophageal sphincter because they've got hiatal hernias. Some have no hiatal hernias, but the sphincter just relaxes a bit more than it ought to, or it intermittently relaxes. And this sort of altered physiology results in reflux occurring, and it can be influenced by environmental factors. All health is influenced by environmental factors. It's why doctors always harp on about how important it is to have a healthy lifestyle and to be aware of your own body and your diet and your exercise routine. So the environmental factors that are important are carrying a bit too much weight. If you're carrying a bit too much weight, there's more pressure exerted upwards from the abdomen on that lower esophageal sphincter region. You're more likely to get reflux. So have to lose a bit of weight. Try and get to a healthy weight. Your diet's important if you're inclined to consume coffee or alcohol or rich foods or other caffeine-containing drinks, or if you're a smoker. These things tend to all promote reflux, and it's important not to eat too late at night where there's a bit more acid being produced and you're going to have acid sloshing around with food in your stomach. You're more likely to reflux when you're lying down flat at night. So it's very important that we look at the diet, we try and get our weight down to control these things. Often these environmental factors by themselves, though, are not enough. And there we like to evaluate patients by passing a flexible instrument through the mouth, right down through the esophagus, into the stomach, and then into the part of the intestine the stomach empties into, called the duodenum. And this is called a gastroscopy. You may have heard of that term. It's done when patients are asleep. Very safe procedure, conducted with an accredited centre. And this allows us to make a very careful evaluation of the lining of the esophagus and to get a visual inspection of the sphincter, whether there's a hernia there. And of course, we're also looking at the stomach, and we're looking at the duodenum. And in general, we'll take small tissue samples of the esophagus. And one of the things we're looking for is a change called a Barrett's esophagus. So Norman Barrett was an Australian, and he described this change in the bottom end of the lining of the esophagus, which takes on the same kind of lining as the intestine, small intestine. It's really a protection in some ways against acid exposure. The lining is a bit more robust against acid, but it also is more likely to become malignant. So we like to look for this change. And if we do find that change, then we have an ongoing surveillance program for these patients. In this gentleman's situation, we're asking him to look at his lifestyle. We're going to inspect him with a gastroscope and check the lining, and that may then lead to the initiation of some medical therapy. And the medical therapy that we use, which has been widely used for almost 30 years now, are acid-lowering drugs. And these drugs are very effective at reducing stomach acid and raising the pH of the stomach to above 4. And this seems to be very important at creating an environment for healing. And these drugs can be taken for 6 to 8 weeks, sometimes longer term. Sometimes they don't need to be used longer term, but they're very effective at inducing healing. Sometimes patients who need longer term treatment may opt for a surgical intervention to repair the bottom end of the esophagus, and that's called a fundoplication procedure, which is generally done by keyhole approach these days. So we have terms for reflux. So we have this term GORD, or GERD if you're American. There's also another term that we use, which is referred to as non-erosive reflux disease. Not everybody who gets heartburn will necessarily have inflammation in the esophagus. In fact, up to 60% of patients with heartburn don't have that much necessarily to find when you inspect them. So we have to be very aware of that as clinicians, and that is called NERD, N-E-R-D. Not actually an insult, although it sounds like it. It's just a term used to describe a non-erosive version of reflux. So in regard to Cameron's diet, if he is consuming alcohol, we're not really too concerned about kind of the standard number of standard drinks. A couple of standard drinks a day we're okay with. His symptoms are more likely to flare if he has more than a couple of standard drinks a day. If he consumes drinks that are very high in alcohol, like top shelf drinks from whiskey, gin, etc. Wine, of course, has more alcohol than beer. So it really depends on the amount of alcohol effectively he's consuming. And we'd like him to limit his alcohol consumption to a minimum.
A number of days a week, like could you have a couple of beers every day?
Well, it really depends. It's hard to give an exact on that. It depends on the underlying problem. So I think if Cameron was consuming alcohol every day and his symptoms were quite active, I'd really ask him to try and abstain for a period of time. He might be amazed at how good he feels not consuming alcohol daily. But it's a bit difficult to give him an exact appreciation of how much alcohol to avoid till we've really examined him carefully. But if he wants to get his symptoms under control, he's got to change what he's doing. What he's doing isn't working. He's got symptoms from his current lifestyle. He has to change his lifestyle, be evaluated properly, and then receive appropriate medical advice about treatment.
I mean, reducing alcohol and rich foods probably reduces his weight as well, so that's sort of a relationship.
Yes.
Is there any particular foods that cause reflux?
Well, the rich foods, chocolate, pepper, and alcohol. Yeah, so one of the things for Cameron to consider is just getting his weight down, reducing his weight to a healthy BMI. And we do know that certain foods will bring on more reflux. We mentioned rich foods and chocolate. Peppermint also can bring on a bit more reflux by relaxing the lower esophagus sphincter and alcohol. So it's important for him to be aware of those foods and also to try and work hard at getting his body mass index down, getting to a healthy weight. And that could be by dieting, it could be by exercise, combination of both, seeking some professional advice from a dietitian, talking to a general practitioner. But it's very important to focus on that. That will be good for his health long term in so many other ways too.
Does fast food more reflux than other food? Does soft drinks matter?
Caffeine-containing soft drinks do. Yeah. So if he's consuming fast food, we'd like him not to. Don't consume fast food so much unless it's a healthy choice fast food. And in terms of soft drinks, well, they are calorigenic, so not good for the body mass index, having lots of sweetened drinks. Why not shift to water and try and change your lifestyle? Again, you'll be surprised how good you might feel.